factors such as interleukin-6 or the activity of COX, which is strongly increased in the cortex of these rats. And as you can see here, treatment with an anti-inflammatory, such as ibuprofen, normalizes most of these inflammatory factors. Therefore, rats with portacabal show neuroinflammation, which can be reduced by treatment with ibuprofen. The question is whether treatment with ibuprofen will normalize the function of the pathway and learning ability. As you can see here, rats with portacabal have impaired function of the pathway, and if we treat them with ibuprofen, this restores the function of the pathway. An increase in cyclic GMP is recovered. And this also restores the ability to learn the Y-maze task. Rats with portacabal need more trials than control, and if we treat them with ibuprofen, this restores the function of the pathway. Therefore, neuroinflammation also leads to impairment of the function of the pathway and of learning ability. However, in these studies, the treatment with ibuprofen reduced inflammatory factors but do not eliminate hyperammonemia. And we have rats with hyperammonemia without liver failure, which have reduced function of the pathway. This seems that there is some incongruence there. And taking into account this data, we led to the hypothesis that hyperammonemia will not do this directly, but hyperammonemia should induce neuroinflammation, which mediates the effect on the pathway. Then we tested whether hyperammonemia induces neuroinflammation. We used the rats with chronic hyperammonemia without liver failure and measured inflammatory factors in brain. In this case, in cerebellum, you can see that there is an increase in interleukin-1 beta and in prostaglandin E2, which are also normalized by treatment with ibuprofen. Therefore, hyperammonemia per se induces neuroinflammation, which can be reversed by treatment with ibuprofen. We then tested whether this treatment with ibuprofen also normalizes the function of the pathway and learning ability in these hyperammonemic rats, and this is the case. Normalizes the pathway, and also treatment with ibuprofen restores learning ability in hyperammonemic rats. Therefore, this indicates that the effect of hyperammonemia on the pathway is mediated by neuroinflammation. It is likely that liver failure induces neuroinflammation also by other mechanisms in addition to hyperammonemia. But hyperammonemia induces these effects through neuroinflammation. Then we asked us, which is the mechanism by which hyperammonemia leads to neuroinflammation? As you have heard during these days, one of the main mechanisms leading to neuroinflammation is activation of microglia, and this leads to a change from a ramified to an amoeboid form of microglia, which releases inflammatory factors. Then we analyzed morphologically if hyperammonemia leads to activation of microglia, and as you can see here, in rats with hyperammonemia without liver failure, microglia reach an amoeboid form, and this is indicating that it is activated, and this is also restored by treatment with ibuprofen. Therefore, hyperammonemia induces activation of microglia, which can be reversed by treatment with ibuprofen. Then the results shown before show that we can restore cognitive function in these rats with portacabal with ibuprofen. Therefore, one possibility would be to treat patients with minimal hepatic encephalopathy with ibuprofen, but as you know better than me, ibuprofen can induce secondary effects in the kidney of patients with liver cirrhosis, therefore it's not a good treatment. Taking into account the results, we thought that maybe we can reduce neuroinflammation directly in the brain without affecting the kidney if we act directly on microglia. Then we looked for some treatment which can reduce activation of microglia without affecting the kidney. And according to the literature, a good candidate for this could be inhibition of MAP kinase P38. Then we tested whether an inhibitor of MAP kinase P38 is able to eliminate activation of microglia in hyperammonemic rats. Well, this was done in rats with portacabal which also have activation of microglia, as you can see here. And Treatment with the inhibitor of the MAP kinase P38 normalizes the morphology of microglia, also reduces inflammatory factors as COX activity or extracellular prostaglandin E2, and also restores the ability to learn the Y maze. Rats with portacabals need more trials to learn, and if we treat with the inhibitor of P38, we normalize the ability to learn this task. Therefore, hyperammonemia leads to activation of microglia, neuroinflammation, reduced function of the pathway, reduced cyclic GMP, which is responsible for the impairment of this type of cognitive function. We also check which is the step of the pathway which is impaired by hyperammonemia, and we found that it is activation of nitric oxide synthase, which can be measured also in vivo by microdialysis by measuring the stable metabolites of nitric oxide. And as you can see here, in normal rats, activation of the NMDA receptors activates nitric oxide synthase, and this is strongly reduced in hyperammonemia. We studied the mechanism by which this occurs in slices of cerebellum, and we found that reduced activity of NOS is due to increased phosphorylation in serine 847, which in turn is due to increased activity of calcium calmodulin kinase 2, which in turn is due to an increased tonic activation of NMDA receptors in chronic hyperammonemia, which finally leads to reduced activation of NOS, reduced function of the pathway, and impaired cognitive function. This glutamate nitric oxide cyclic GMP pathway is modulated by many different neurotransmitter systems and conditions, and one of the neurotransmitter systems which modulate this pathway is the GABA-A receptor. It is known by studies of Raitieri Fedele in Italy that activation of GABA-A receptor impairs the function of this pathway. For example, in our conditions, addition of muscimol, which activates GABA-A receptors, impairs the function of the pathway and reduces the formation of cyclic GMP. Then one possibility is that in hyperammonemia there is a increased GABAergic tone with increased basal activation of GABA-A receptors, which impair the function of the pathway and reduces formation of cyclic GMP. If this is the case, we should be able to increase these cyclic GMP levels by blocking GABA-A receptors, which will eliminate this inhibition. And we can do this by using bicuculin. And we tested what happens if we administer through the microdialysis-proof bicuculin. These are the results. This is the basal level of cyclic GMP. And in normal rats, if we add bicuculin, nothing happens, essentially. This indicates that if you block GABA-A receptors, the function of the pathway is not affected, indicating that these receptors were not activated and were not inhibiting the pathway. However, in hyperammonemic rats, if you add bicuculin, cyclic GMP increases strongly. This indicates that GABA-A receptors were activated tonically and were impairing the function of the pathway. There is an increased GABAergic tone in hyperammonemia in cerebellum, not in cortex, but in cerebellum. And this contributes to impairment of the function of the pathway. Then, if this is able to restore the function of the pathway, at least acutely, should also be able to restore learning ability. Then we tested whether chronic treatment with bicuculin is able to normalize the function of the pathway and to restore learning ability. And as you can see here, this is the case. It depends on the dose that you use, but with a proper dose, you can restore the function of the pathway and learning ability. Hyperammonemic rats need more trials than controls to learn, and with 0.1 milligram per kilo of bicuculin, you are able to normalize learning ability in hyperammonemic rats. Therefore, in summary, the results show that chronic hyperammonemia leads to increased activation of MAP kinase P38, activation of microglia, neuroinflammation, increased activation of NMDA receptors and of GABA-A receptors, which I believe there is an interplay in this. We are trying to understand it. And all of this leads to reduced function of the glutamate nitric oxide cyclic GMP pathway, leading to reduced formation of cyclic GMP, which impairs cognitive function. And we can restore these levels of cyclic GMP by different mechanisms acting on these steps, inhibitors of phosphodiesterase 5, which directly increase cyclic GMP, restore learning. Also inhibitors of MAP kinase P38 or anti-inflammatories such as ibuprofen, restore cyclic GMP and learning. And also modulators of GABA A receptors are able to restore the function of the pathway and learning ability. Therefore, all these could be possible therapeutic treatments in patients. Some of them will have secondary effects, but can be overcome. For example, several companies, pharmaceutical companies, are developing inhibitors of P38 for treatment of chronic inflammatory diseases, and maybe this will be available soon. Phosphodiesterase inhibitors are being used for erectile dysfunction and now also for pulmonary lung hypertension and for hyperplasia of prostate. And also modulators of GABA A receptors can be used as tools for improved cognitive function. As you have heard during these days, 3 minutes. Main modulators of the GABA system are the neurosteroids, which also modulate other receptors such as NMDA receptors or sigma receptors. Then we tested whether neurosteroids modulate the function of the glutamate nitric oxide cyclic GMP pathway. We tested different types of receptors, of neurosteroids acting on different receptors. And as you can see here, for example, pregnenolone or TH-DOC act as agonists of GABA A receptors and reduce the function of the pathway. Pregnenolone, for example, does nothing. And we found one of them, which is pregnenolone sulfate, which acts as an antagonist of GABA A receptor and agonist of NMDA receptors, which in hyperammonemic rats normalizes the function of the glutamate nitric oxide cyclic GMP pathway. This is basal level of cyclic GMP in hyperammonemic rats. If we add NMDA, the cyclic GMP increases here because the function of the pathway is impaired compared to controls. But if we treat these hyperammonemic rats with pregnenolone sulfate, this restores the function of the pathway. This is an acute administration. We tested whether chronic administration of pregnenolone sulfate also improves the function of the pathway, and this is the case. This is the pathway in hyperammonemia, and this is in hyperammonemic rats with pregnenolone sulfate. This restores the function of the pathway and also restores the ability to learn the White-Maze task. Rats with hyperammonemia need more trials than control to learn, and pregnenolone sulfate restores the function of the pathway and the ability to learn. Therefore, in summary, there is an interplay between glutamatergic and GABAergic neurotransmission in cerebellum in the impairment of the function of the glutamate nitric oxide cyclic GMP pathway and these some types of cognitive function. And there are different targets on which we can act to restore the function of the pathway and learning ability. And this is the people who is doing the work. Thank you.